A special thank you to each of our subscribers who make this channel possible. Here's today's story. In a historic move, Senate Republicans have successfully passed President Donald Trump's extensive tax and spending package, affectionately dubbed the One Big Beautiful Bill. This sweeping legislation is poised to bring about significant changes, particularly to the Medicaid program, which could have dire consequences for millions of Americans relying on this essential health coverage. If the House of Representatives follows suit and approves the bill, which is expected to happen shortly before the July 4th holiday, the ramifications could be devastating for those who depend on Medicaid for their healthcare needs. Since the implementation of the Affordable Care Act, ACA, in 2010, the rate of uninsured individuals in the United States has plummeted from approximately 14% to a historic low of under 8%. This remarkable achievement, which has resulted in around 26 million Americans currently lacking health insurance, is now at risk due to the proposed budget bill. The Nonpartisan Congressional Budget Office, CBO, estimates that the Senate version of the bill could lead to nearly $1 trillion in cuts to the Medicaid program and potentially strip coverage from nearly 12 million individuals by the year 2034. While the bill is still subject to potential revisions before final approval, the implications of these cuts are already raising alarms among health policy experts. Zach Levison, a noted health policy expert at KFF, warns that such drastic reductions in federal healthcare spending could severely impact hospitals across the nation. Cuts of this magnitude are likely to result in staff layoffs, reduced services, or even hospital closures, Levison stated. With an estimated 12 million people projected to lose their health insurance, many will struggle to afford necessary medical care, leaving vulnerable populations at an even greater risk. The White House has defended these cuts, asserting that they are designed to eliminate waste, fraud, and abuse within government programs, ultimately aiming to protect those who rely on Medicaid. However, one of the most contentious aspects of the legislation is the introduction of a work requirement for Medicaid enrollment. Traditionally, Medicaid eligibility has been determined based on income and disability status, with no federal mandates concerning employment. Under the new bill, adults will be required to work or volunteer a minimum of 80 hours per month to qualify for coverage. While exemptions are provided for disabled and pregnant individuals, the new stipulations could create significant barriers for parents of children with special needs, according to Deborah Greenhouse, a pediatrician and spokesperson for the American Academy of Pediatrics. Additionally, the bill proposes that states reassess Medicaid eligibility every 6 months instead of the current annual checks, which could create hurdles for non-English speakers and individuals with low literacy levels. This increased frequency of reapplication may further complicate access to health care for those who already face challenges navigating the system. The legislation also seeks to tighten access to health plans through the insurance marketplaces established by the ACA by shortening the open enrollment period and eliminating automatic renewals for policies. Instead, policyholders will be required to update their personal information regularly to retain coverage, a move that critics argue could disenfranchise many individuals. Rick Pollack, president and CEO of the American Hospital Association, expressed deep concern over the potential fallout from the bill, noting that the loss of coverage could lead to increased uncompensated care for hospitals, ultimately affecting their ability to serve all patients effectively. Furthermore, the GOP's plan aims to restrict a funding mechanism that states utilize for their Medicaid programs, known as provider taxes, which are levied on healthcare providers. The CBO anticipates that states will be forced to modify their Medicaid programs significantly, potentially leading to reduced provider payment rates, a decrease in the scope of services offered, and an overall reduction in Medicaid enrollment. Jake Hazelsworth, an associate professor specializing in government and public affairs, emphasized that the bill carries far-reaching implications for the future of the Medicaid program. States will have to find alternative funding sources to maintain services they have historically provided, he stated. As the House prepares to vote on the One Big Beautiful Bill, the stakes have never been higher. With millions of Americans' healthcare coverage hanging in the balance, the outcome of this legislation will undoubtedly shape the landscape of health policy in the United States for years to come. The potential for increased uninsured rates, coupled with the burden placed on healthcare providers, raises pressing questions about the future of healthcare access in America. As the clock ticks down to the House vote, all eyes remain on Congress to see if this controversial bill will indeed become law, leaving many to wonder what it will mean for the health and well-being of millions across the nation. That's all for this story. We upload videos every day covering many different subjects, so hit that subscribe button to stay informed. Thanks for watching.